I'm Ursula Schmidt-Erfurth. I'm a retina specialist and have a research priority in artificial intelligence, in imaging, and I'm from the Medical University of Vienna, based in Austria.
Please tell us about your presentation this year at AAO.
So today I talked about the role of AI-based image analysis for the management of geographic atrophy, which is the leading disease for severe and irreversible visual loss. Geographic atrophy leads to a disappearance of the cell layers in the center of the retina, the macula, which is the retinal pigment epithelial, and the photoreceptor layer. We were able to work on the data of one of the first phase 3 clinical trials that provided proof of principle that treatment of geographic atrophy is possible by introducing inhibition of complement. These 2 phase 3 clinical trials just came out, and with them a large and robust data set of images. The AI algorithms that my expert group at the university has developed, which are validated, could be applied to these large data sets, and we could specifically search for disease activity and therapeutic response patterns in these images. So OCT analysis using these AI-based segmentations showed that we can precisely image the integrity of the photoreceptor layer and of the retinal pigment epithelium in a micrometer scale, so very precisely. We could show that in the treatment arm, RPE destruction, and this is what clinicians see, is significantly slowed. But this difference between treated and untreated eyes on the RPE level is just half of the story. What is more important, and where we see more aggressive disease activity and superior treatment effects, is at the level of the photoreceptors. Photoreceptors can be imaged by using a composition segmentation network, because it's more difficult to visualize the photoreceptors. But with this tool, we can show photoreceptor loss, photoreceptor thinning, and photoreceptor integrity. And the data, phase 3 data in the complement inhibition trial clearly demonstrated superior preservation of photoreceptors. And this change was much more significant even than the effect on the RPE. That is most important, as the photoreceptors are the correlate for visual function. So they represent function on a morphological level. That is very new insight from 2 perspectives. One is to understand geographic atrophy. The geographic atrophy starts with a subclinical change that is photoreceptor loss, first small, then expanding. And the RPE loss, this is clinical, this is what clinicians can see, follows. And it is always the photoreceptor loss that precedes and exceeds RPE loss. And the second insight is that complement inhibition can preserve photoreceptor integrity, and it can do so very consistently. And that is what we were able to show and to talk about today.
What was the complement inhibitor that your team was monitoring?
The new substance that was used to treat geographic atrophy was pegcetacoplan, which is a C3 complement inhibitor, and this is done in the trials of Apellis.
Are there future clinical applications?
The results of these studies will lead to a more practical and more sound management of geographic atrophy, because it will allow us to develop clinical decision support tools. That means AI-based real-time and objective measurements that show which patients have disease activity, which patients will respond well to therapy, and it will allow to monitor these patients for a lifetime, as we are talking about a disease with chronic lifetime progression.
Will this new AI testing be able to predict disease and possibly influence treatment plans?
Particularly photoreceptors, but also RPE, are subclinical features. They are not seen easily by the clinician. So AI-based image analysis is needed to measure those changes. This is important to identify patients that do have disease activity in contrast to all comers, which in a disease that has a slow progression and a very huge variability is key to identify those patients that will benefit from treatment. It will also allow us to identify the earliest stages of disease, as even with complement inhibition, there is no reversal of photoreceptor loss possible. And the earlier you treat, the higher is the chance that photoreceptors can be preserved at a level where visual acuity will remain perfect throughout lifetime.
Is this technology currently available to everyone?
The AI-based analysis, the deep learning-based analysis that we developed is entirely innovative, and it is the first proof of principle that these tools can be used for clinical patient management based on the consistent results in the phase 3 clinical trial with a lot of patients and a large variety of different disease stages included.